Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about a common condition that affects children and adolescents and even some adults. ADHD, or Attention Deficit Hyperactivity Disorder, affects 3 to 5% of all children in the world. Express Care's Dr. Jitka Lom joins us in studio to tell us more about this disorder, how to recognize the signs in your children, and how to deal with ADHD. Thanks, Doc, so much for coming in. So what is ADHD? ADHD, I'm sorry, I think we don't have this today.
That's okay. Yeah, let's talk about what it isn't. It's not bad parenting. It's not bad children. This is actually a disorder that is a disorder of the brain, which you can measure on functional MRI scans, where the frontal lobes of the brain are not modulating well enough the behavior of the child. So what is it in a nutshell? It's a difficulty of the brain in deciding what to focus on. So in this room, you know, there are so many things. I'm focusing on you, right? And the camera as we're talking. I'm able to filter out all the other distractions. People with ADHD can't. They are bombarded with stimuli and they have a hard time choosing one thing to focus on for any length of time. If they do manage to focus on it, it has to be very interesting to them, very unique for them to be able to stay with that.
Now, what causes it? You were talking a little bit about, you know, the brain.
Yeah, it is genetically, it's something that you're inborn with, born with, I should say. And it's aggravated by certain things in your childhood, such as excessive stimulation, for example, from TV and video games at a very young age. So the the American Academy of Pediatrics recommends that children below the age of 2 watch no TV and do no video games, and between 2 and 4, it's very, very limited, less than half an hour a day. It does not really matter what program your child is watching. It's just not the right thing for their brain.
Oh, interesting. Yes. Okay, so parents can actually avoid, to avoid this from happening.
Yes, you really can. It's just too much stimulation for a developing brain that is just learning how to pay attention to different things at different times. If you have too much coming in, it cannot learn those tasks.
Now, you were mentioning when we talk about how is it diagnosed, is it just through that, would you say through the scan?
Oh, you can do it's called a functional MRI, but those are expensive tests. It's really diagnosed through a series of criteria. That there's a big long list, and you have to get a certain number of those criteria to have ADHD. That includes things like not being able to pay attention to tasks and taking much longer to complete your tasks, losing things, forgetting things, not being able to concentrate, basically, and also doing impulsive behaviors like speaking out of turn, not being able to, wait your turn in line, basically bouncing off the walls like some children do.
Okay, and so there's also, it's not just children and adolescents who are dealing with this. Sometimes even adults can have it. When we talk, how do adults deal with ADHD? I was reading that it can impact their time management, their organizational skills, and really have an impact on the job.
Oh, that's for sure. Now, one thing that's important is to know that for any ADHD, it has to have started before the age of 7. So if you're 35 and you think you just got ADHD, no, you're just overwhelmed, and that's different. So how do people with actual adult ADHD deal with it? Generally, they take some medicine to help them be able to focus. Choosing jobs where they're able to work in either by themselves or in small groups, and avoiding those situations where they would have to multitask is best for that kind of person. They wouldn't make a very good air traffic controller.
All right, and I think that's one of the most stressful jobs,
very
right?
Stressful.
All right, so now how does a parent know the difference between just their child being active but inattentive maybe to certain things, as opposed to their child actually having ADHD? You were talking about some of the things to look for, but I guess that'd be like a fine line.
There's and sometimes a very gray line, because of course children develop and they learn skills, and not every child needs medication. They just need time and attention to things like focusing. For example, things like doing puzzles with your children, slower tasks that take a little bit more time, cooking, also sports such as martial arts, jiu-jitsu, those kind of things will help children to develop. Ballet, those kind of things will help.
Okay. Now, You mentioned medication. Is medication the only route for parents to go and the only way to address ADHD?
No, not at all. When parents are aware that their child has ADHD, they can work with behavioral skills such as teaching your child to organize themselves, having schedules, having a lot of Post-it notes around, having different boxes for their belongings, teaching their child to clean up their room tile by tile, floor tile by floor tile. Different ways that you can strategize also with the teacher. Working in small groups or one-on-one is really important. But sometimes medication is required, and it really does help, especially for those kids who are really impulsive.
Okay, sounds good. Well, we have to take a quick break, but we will pick up our discussion on ADHD when Healthy Living returns, including your questions in just a moment. Stay with us.